Good evening. This is Dawood Al-Kous from the American Vision University. Here I will highlight my case study for the philosophical foundation of healthcare education. Initially, I go through the definition of the health education versus health promotion and highlighted that health education is not concerned about the communication of information but also fostering and motivation, the skills and confidence that necessary to take action to improve the health, while the health promotion is the processes of enabling people to increase the control all over their health. The case study was that Angelica is a health educator, professor employed by a state university, and the local newspaper wants to interview her about the Affordable Health Care Act's prevention component, including how the Act enhanced the health of the reader. We have some case questions. The first question was if a health educator is simply considered as someone who inform others about health, who would be considered the humanities first health educator? Now, when we go and we dig deep, it's commonly accepted that these basic concepts of health promotion have been developed in the last 2 decades, but it have a root in the ancient civilization and in particular in Greek antiquity. The second case question was if a health education specialist trained in the year of 2013 traveled back to the Middle Ages, what impact could that person have to the health problems of that area? What positive factors would work to health educator specialist as a favor, and what negative factors would work against the health educator specialist? Actually, in the Middle Ages, there was the main concern was the spread of infections due to the lack of education, to the poor hygiene. There were a lot of diseases, and especially infectious disease. So if someone go back from 2013 to the Middle Ages and health education was there, definitely that will have a positive impact on the educational level, on the awareness level of the people, to decrease the death rate at that time, to decrease the very high spread of infection among the people due to the poor hygiene. Healthcare specialists can work there to improve the people awareness about the importance of the hygiene, about the prevention of the spread of those infections. Yes, there were some positive factors at that time that even without healthcare specialists, there were some attempts to cope up with this uncertainty condition of the cities, and by means of they made some quarantine limited to spread the disease. They established some hospital, and also the provision of medical care and social assistance was there. They have some attempts to increase the level of health education and personal hygiene. So some willingness was there for some countries, while on the other hand, some things might work negatively and affect the work of the health educator, was the little concern about the hand hygiene, and also there was not very unsuccessful due to ignorance of the principle of the public health. The third case question was when the first school were begin started in Massachusetts, do you believe that health education promotion have been accepted and the academics as an academic subject? I don't think that it was important for them, and it was not accepted as academic subject because they were focusing on the basic education. The second part of the question, why do you believe that health education and promotion is accepted as academic subject at the present time? For sure, for the present time, yes, it's accepted subject because there is an increase in the level of the awareness of the people, and the importance of the health education. There is a lot of researches and studies show that there is a positive impact with the health education and the promotion on the all over health of the communities. The fourth case question was to go online and to find to the Healthy People 2020 and pick up one of the goals and set, which I believe it's very important role and very important objective, and the role of the health educator. I picked that the goal of promote quality of life, healthy development, and healthy behavior across all life stages. I think this is very important objective, and the health educator or health education specialist have a big role in this one, especially if they focus on the awareness program and for the community, starting by the primary health care to prevent the diseases, to control also the chronic disease. So they will have a big role in this one. Thank you so much.